Millions of seniors have been vaccinated in Florida, but as the state begins to lower age requirements for the vaccine, many of the most frail and vulnerable inside low-income housing still have not received a shot. News4 Jax reporters Kelly Wiley and Joe McLean are continuing our coverage of the pandemic at 6 o'clock. We begin with Kelly, who went to the towers of Jacksonville today.
Seniors in nursing homes and assisted living facilities were some of the first to be vaccinated against COVID-19. Then this week, the state went into 145 HUD Section 202 facilities to vaccinate thousands of seniors. But some elderly in Jacksonville's low-income housing still have not been reached, particularly some of the most frail living in Jacksonville Housing Authority building. Otis Best got his shot from the VA. He's a Vietnam veteran living at Centennial Towers. He says many inside would benefit from a clinic at the facility, like they've done at other locations.
Either don't have a way to go, and then you got others, I think they just kind of leery of the vaccine.
Marvin Levine says he managed to get a state vaccine clinic at the independent living facility he helps run after weeks of phone calls.
I got almost 200 people that live here, and I'd say about half of them got their shots elsewhere already, but the other half were unable to get out. They don't have the money to get a cab or transportation. They don't have a support system as family. Some of them can't leave their apartments. Some of them are, too ill. And I'm grateful for them to come and vaccinate our people, because the atmosphere around here is so much nicer and so much calmer, and you can just feel the relief on in their voice.
The Jacksonville Housing Authority says it's trying to sign up seniors for vaccine appointments and is lining up a third-party provider to come in and vaccinate seniors when they get a supply of vaccine.
And we still haven't heard from the Florida Division of Emergency Management on whether their next priority will be to go into these city-run housing authorities like JHA. We have not heard back on that. But one thing that I did notice as we were talking to the different people at these 4 JHA facilities across town is that many of them, when they say that they are unsure about the vaccine, I'll ask, hey, what did your doctor tell you? And a lot of these people have not gone to the doctor in a very long time. So they really have not gotten a lot of information on how this could benefit them. A lot of them tell me that they have lots of pre-existing conditions that would qualify them, age or not, like diabetes, obesity, but they're just not getting enough information on what they can do and what this vaccine would do for them either. So it's a big hurdle, not only access-wise, but also just information-wise. Reporting live in Jacksonville, Kelly Wiley, Channel 4, the local station.